Hello. The basic of pharmacology is fundamental element of anesthesia providers' knowledge. In this section, we will talk about pharmacokinetic principle. So, what exactly is pharmacokinetic principle? The pharmacokinetic principle are the principle which governs the comparison of drugs concentration in plasma or at effect site compared to the drug dose over a period of time. And this is governed by many factors. In this section, we would discuss about those factors. So, pharmacokinetic principle, as I said, is relationship between the drug dose and drug concentration in plasma or at effect site over a period of time. So, what governs this pharmacokinetic principle? So, whenever we give the drug gets absorbed, then the drug gets distributed and the drug gets eliminated. For IV drugs, the absorption part is not there because we are directly giving the drug intravenously. But by other routes, when we are giving the drug, then absorption, distribution and elimination, all three holds the significance. But for IV drug, it is distribution and elimination. So what governs this pharmacokinetic principle? The first thing is absorption of the drug. Absorption of drug, which is not relevant on IV injection, not relevant for intravenous drug, for IV drugs. The second is your distribution. Now distribution, this is very much important for IV drugs, and your elimination. So for intravenous drug, these two factors are important, distribution and your elimination. They will govern the pharmacokinetic principle. And in this, we will talk about a very important concept, volume of distribution and clearance of the drug. Apart from that, many other concepts also we will discuss. So distribution and elimination is what we have to consider for intravenous agents. Now, your pharmacological parameters, how they are calculated for a drug. Now they are calculated based on mathematical model fit, which is let's say derived after calculating the concentration of drug at time intervals after giving a fixed dose of drug in plasma or at effect site. So pharmacokinetic parameters, pharmacokinetic parameter of any drug, pharmacokinetic parameters are derived. They are derived from mathematical formula fit, from mathematical formula fit to measured blood or plasma concentration, over time following the known dose of drug, right? So your pharmacokinetic parameters of the drug are derived from these mathematical formula fit, which is measured blood or plasma concentration over time following a known dose of drug. In this, we need to, in your pharmacokinetic concept, we need to understand the concept of volume of distribution, which we will discuss. So we'll talk in detail about what is volume of distribution. We will talk about something called clearance of the drug, how the drug is removed from the body, clearance. We will talk in that front end kinetic. So we'll talk about front end kinetic as well. We'll talk about back end kinetic, which is important in case of when we are giving the drug through infusion, context sensitive, half-life, etc. And we will also talk about biophase. Okay, so we'll talk first about volume of distribution. So let us discuss what is volume of distribution. So how do I define this volume of distribution? What do I mean by this term volume of distribution? Volume of distribution is a pharmacokinetic parameter which tell us propensity of the drug to remain in the plasma or get distributed to the peripheral tissues. So, volume of distribution, which is written as VD, volume of distribution is written as VD. This is a pharmacokinetic parameter. This is pharmacokinetic parameter, representing the drug's propensity, drug's tendency, drug's propensity either to remain in plasma, either to remain in plasma or distribute to other tissue compartment, Now, to understand volume of distribution, now let us discuss how the formula to calculate the volume of distribution was evaluated. How the formula was evaluated, right from talking oversimplified, let's say, model of volume of distribution to the complex model of volume of distribution which is in our body. So we will discuss in this section how the formula to calculate volume of distribution. We will also discuss what are the different parameters which gets affected by volume of distribution of a drug, and what are the different parameters which affects the volume of distribution of drug, and what is the clinical importance of this volume of distribution. So we will talk about oversimplified model, oversimplified single compartment model, right? Single compartment or single tank model, single compartment model. So how we will calculate volume of distribution if there is only one compartment in which the drug is given and there is no elimination of drug. Then we will see how the formula changes when in this single compartment, we add a tap to eliminate the drug. And then we will talk about what is present in our body, that is the complex multiple compartment, right? So how the formula will evolve when we have to consider more than one compartment, more than central compartment. So first let us talk about the single compartment oversimplified model of volume of distribution. So whenever we give a drug, the dose of drug, let's say I have given 10 milligram, the drug goes into the intravascular compartment. Let's say it is a closed compartment, there is no elimination of drug and there is no removal of drug and no movement of drug from this compartment. What would be the volume of distribution of drug? It would be the whatever volume is present in the plasma, it would get distributed in the blood, it would get distributed in that volume. So how would we calculate the volume of distribution? We would calculate by the total dose of drug divided by the concentration of drug. So let's say the total dose of drug is 10 milligram. Let's 10 milligram the amount of drug, and the concentration of drug in a fixed volume is 10 milligram per liter. It is 10 milligram per liter. So what would be the volume of distribution of this drug? It would be 1 liter. The volume of distribution is 1 liter. So what is volume of distribution? It is a proportionality constant which represents the total amount of drug divided by the concentration of drug at a given time. Concentration of a drug at a given time. So volume of distribution is a proportionality constant that relates the total amount of drug in the body. We have to remember this, in the body. So whatever we have injected, total amount of blood in the drug in the body, divided by plasma concentration of drug at a given time, right? To plasma concentration of drug at a given time. So we have to remember this, what the formula of volume of distribution. Let's say in this, when we had a closed single compartment, whatever was the volume of the single compartment, that was the volume of distribution of the drug. Now but this is not what happens in the body. Whenever we give the drug, the elimination also starts. The elimination process of elimination also starts. So if we add tap in this central tank, what will happen? The human body, as it is not a closed compartment, through, let's say, the tap which has been added, the drug would get eliminated. If the drug gets eliminated at a constant rate, right, then over a time period, change in the concentration of the drug would be proportionate. And then how we will calculate the volume of distribution? So let's say as soon as drug is injected, it begins to clear, begins to get removed from the body. So let's say I have added 10 milligram of drug, and let's say it starts getting eliminated. After 2 minutes of giving the drug, only 5 milligram of drug was there in the blood, right? The amount of drug in the blood was only 5 milligram. The concentration of the drug at that point of time was 5 milligram per liter. So what would be the volume of distribution? The amount of drug at that time of 2 minutes, 5 milligram, divided by 5 milligram per liter. It was 1 liter. So after 2 minutes, after 2 more minutes, that is after, let's say, 4 minutes, more drug was eliminated, and now only 2.5 milligram of drug was there in the plasma, in the body, or the concentration was 2.5 milligram per liter. So still the volume of distribution was 1 liter. So volume of distribution remained constant, right? If volume of let's say distribution will remain constant if the elimination process follows the first order kinetic or first order. What do I mean by this first order kinetic? I mean by this first order kinetic is that elimination is directly proportional to the concentration of drug in the plasma. So the volume of distribution will remain constant or proportionate, right? If elimination follows or occurs elimination occurs at first order process. What do I mean by this first order process? I mean by it, elimination is proportionate to concentration of drug at that time, at that time point, right? So volume of distribution in this case also will remain constant at 1 liter, right? Constant elimination is happening from the body, but the volume of distribution is same of the drug. But again, the body is not single compartment. Whenever we give a drug intravenously, the drugs from the central compartment starts going into the peripheral compartment. A very small amount of drug remains in the central compartment, more and more drug moves to the peripheral compartment. The movement of drug to the peripheral compartment depends upon the, let's say, depends upon lot of factors, like how much is the drug soluble in the peripheral compartment, or how much is the drug attracted towards the peripheral compartment. So when we give the drug, when a drug is administered intravenously, when we give it IV, only small amount remains in blood. The major drug, the major amount distributes to peripheral tissue. So more and more it will get distributed. This additional volume of distribution would get added to the central volume of distribution. So this distribution distribution to the peripheral compartment. Distribution to peripheral compartment, which is connected to the central compartment, is additional volume of distribution. This distribution to the peripheral compartment is additional volume of distribution. So we now have to calculate additional volume of distribution. We have to consider this additional volume of distribution. So now we have to calculate the volume of distribution by considering this additional compartment also. So what are the factors which we have to know? So let's say this is our central compartment and I am giving the drug, the dose of fixed dose of drug, let's say 10 milligram in the central compartment. Now drug is moving out of the central compartment by two ways. One, either it will get eliminated or it will move to the other peripheral compartments, right? So what is the dose which is remaining in the plasma depends upon the interplay of two things. How much drug is eliminated and how much drug moves to the peripheral tissues. Now, how we will calculate the volume of distribution? The formula said that the amount of drug divided by the concentration of the drug at that point of time. So how much drug we gave to the patient? 10 milligram. And let's say after 10 minutes I calculated what is the concentration of the drug in the plasma. It came out to be 2.5 milligram in 1 liter. So now volume of distribution, putting the values in the formula, would be 10 milligram divided by 2.5 milligram per liter. So now the volume of distribution is 4 liter. So volume of distribution goes on increasing when the drug starts moving to the peripheral compartments. And we need to remember a few very important things regarding this volume of distribution. Number one, that there may be more than one peripheral compartment in which the drug will move. Then in the peripheral compartment there are tissues to which the drug can bind. So further the volume of distribution of the drug would increase. Then more the drug is soluble in the peripheral compartment, more the drug will move to the peripheral compartment, and that will depend upon the lipid solubility of the drug, the acid and basic nature of the drug, etc. So what are the points that we have to remember for this volume of distribution? First, there may be more than one peripheral compartment, more than one peripheral compartment, right? So there may be more than one peripheral compartment. More soluble drug in peripheral compartment, more it will move to the peripheral compartment. In peripheral compartment or tissues, more soluble the drug in peripheral tissues relative to blood, compared to blood, relative to blood or plasma, right? Related to blood or plasma, the more peripheral volume of distribution, more peripheral volume of distribution. Now apart from that, I said we need to remember the drug can also bind to the tissues present in these peripheral compartment. So the drug may bind to tissue in peripheral compartment, right? So this will further lower the concentration of the drug in the central compartment. So it will bind to the tissue in the peripheral compartment. This will lower further the central compartment volume, right? So we will have even larger volume of distribution. And since we are understanding these 3 points, if we consider these 3 points, number of times the volume of distribution is even more than the volume of distribution, the central volume of distribution added to the peripheral volume of distribution, because drug is binding to these tissues present in the peripheral compartment. So for example, if I consider a drug fentanyl, for fentanyl what is calculated? What is the calculated volume of distribution? The calculated volume of distribution of fentanyl is 4 liter per kg. This is the fentanyl volume of distribution, overall volume of distribution. Now its vascular volume of distribution, that is in central compartment, is 0.07 liter per kg, and its extravascular volume of distribution is your 0.2 liter per kg. So if we add the vascular and the extravascular, it comes out to be 0.27 liter per kg. But what is the volume of distribution of fentanyl? 4 liter per kg. So how is this higher volume of distribution? How more where has drug gone? The drug is bounded to, this is bounded to tissues present in the peripheral compartments. So we have a wider volume of distribution, right? So when we calculated volume of distribution when there was only one single compartment and a constant rate drug was getting eliminated, over the time volume of distribution remained constant. But when this multiple compartment concept has come, over the time the volume of distribution will differ. When we give the drug has a smaller volume of distribution, that is more drug will remain in the intravascular compartment. So we have a smaller volume of distribution, right? As the time passes and more drug moves to the peripheral compartment, we will have a larger volume of distribution. So if we see this graph, what do we see? That at, let's say, 0 to 2 minutes, the volume of distribution is 4.27 liter, okay? And at 8 to 10 minutes, the volume of distribution is 48 liters. So this means more and more drug moved to the peripheral tissues. So volume of distribution increased. So what I am trying to say, that with additional tank, with additional compartments, volume of distribution does not remain constant over time. Volume of distribution varies over time. Distribution vary over time. So at time 0 it was 4.3 liter, at time 10 minutes it was 48 liter, right? This increase is due to distribution of drug into the peripheral compartment and also elimination of drug. So this decrease in the concentration of drug in the central compartment is due to movement of drug in the periphery and also elimination of drug, right? Now remember that when we give the drug during first few minutes, the volume of distribution is more affected by the movement of drug to the peripheral compartments, and later on it is more affected by elimination of the drug. So if I show you the comparison graph of amount of drug over the time, right? So the blue one is amount of drug getting distributed to the peripheral tissue, which is more during initial few minutes, and the yellow line is amount of drug which is getting eliminated, is the elimination time. So later on the elimination takes over, but initially the distribution of the drug into the other tissues are the predominant thing which is affecting the volume of distribution. Okay, so this is how the volume of distribution gets affected. So how do we calculate volume of distribution? Total amount of drug that I have given divided by concentration of drug in the intravascular space at that point of time. So more and more drug will move to the peripheral tissue or get bounded to the tissues present in the peripheral tissues, right? Higher would be the volume of distribution. And how would this volume of distribution affect the half-life of the drug, right, which we have to consider. So let us talk about the concept of volume of distribution and half-life. So how do you define the half-life? The half-life is of any drug is the time taken by the drug to achieve 50% of its concentration. So half-life or T-half, refers to time taken, time required for plasma concentration of a drug to decrease by 50%, right? And it is dependent on rate constant K. It is dependent on rate constant K, and this K is dependent on, which makes the half-life dependent on volume of distribution and the clearance of the drug, So it is dependent on these two factors. Now how do we calculate the formula to calculate the half-life? So half-life is calculated by in hours. Half-life in hours is calculated by multiplying 0.693, that is the constant, multiplied by volume of distribution of the drug and the clearance of the drug, divided by clearance of the drug. So this is the formula to calculate the half-life of any drug. Now, how is half-life affected by volume of distribution? We have to understand this concept. So half-life is drug getting eliminated from the plasma, right? Time required to achieve 50% of the plasma concentration. So how would drug go out of the plasma, right? I mean, totally eliminated from the plasma, totally cleared from the plasma, is how the elimination of drug only happens from the central compartment, because the let's say tissues which is responsible for elimination is mostly liver and kidney. So elimination is the function of the central compartment. So only the drug present in the central compartment, can be eliminated, right? They can be eliminated because elimination is primarily carried out by liver and kidney, right? So let us talk about how would a larger volume of distribution affect the half-life. If a drug has a high volume of distribution, what happens? Now this is the central compartment, this is connected to the peripheral compartment, okay? And let's say the elimination of the drug is also happening. So this is the concentration of drug in the central compartment and this is the concentration of drug in the peripheral compartment. So from the central compartment, when the drug is eliminated by liver and kidney, the drug is metabolized, the concentration of the peripheral compartment becomes more. So more drug from the peripheral compartment moves to the central compartment and try to maintain the concentration of drug in the central compartment. Now more drug is eliminated, again more and more drug moves from peripheral to the central compartment. Again the concentration of the drug in the central compartment is maintained. So the time taken to achieve that 50% of the concentration would be longer. So larger the volume of distribution, larger would be the half-life of the drug. More time, more would be the half-life. So fraction of drug eliminated shifts the equilibrium from peripheral to the central compartment, and this shift maintains this steady state concentration, right? Steady state concentration despite drug removal, despite the elimination of drug, right? So remember that plasma concentration decreases slowly during elimination for drug with a larger volume of distribution, during elimination in drugs with larger volume of distribution, right? So if I keep the clearance of the drug constant, if let's say this clearance is constant clearance, at constant clearance, the half-life would depend upon the volume of distribution. The half-life would be longer if there is a larger volume of distribution. The half-life would be shorter if the drug has a shorter volume of distribution, right? So volume of distribution affects the half-life of the drug. Now there are two more definitions half-life. We need to understand the distribution half-life, which represents amount of time in which the drug becomes 50% of the initial concentration during the distribution phase, So plasma concentration to decline to 50%. Elimination half-life, amount of time required the plasma concentration to decline 50% during the elimination phase. And for let's say a drug with a longer volume, a higher volume of distribution, the elimination half-life would get prolonged, right? The half-life of the drug would get prolonged.